I want to thank Dr. Sophia Chen, Secretary of Food and Health here in Hong Kong, for joining us for this discussion about the vaccine rollout. And specifically, I want to ask Dr. Chen about Hong Kong, but also maybe contrast what is happening around Asia, maybe kind of from her professional lens. Compare and contrast what's going on around Asia as well as the world. So, Dr. Chen, you are probably one of the hardest women, working women in Hong Kong today, and I want to thank you on behalf of all of us. This has been a tough year since in Hong Kong we kind of got it earlier than anybody else. We started hearing about it in January. So your life, all of our life, have changed now for forever. But can you tell us more about some of the latest development with the vaccine rollout program in Hong Kong, which began in February?
Thank you, Alice. I think it's been a challenging year for all of us, and but I continue to be proud to be part of this fight, with the virus. Of course, vaccination is something that we have always been hoping for, and now we have it in Hong Kong. Since I think the 26th of February, we have authorized, 2 types of vaccine for use, for emergency use in Hong Kong. So we have started the vaccination program. And ever since the past few weeks, we have been expanding the priority groups. Initially, we started with a few groups, including, of course, healthcare professionals and people working in the elderly homes and people who are in critical services and so on. But most recently, we have lower the age limit starting from 30 to 59. And of course, those who are above, 59 are also included. So now the eligible population is about 5.5 million. That is about 80% of people who are eligible above 16 of age, because the 2 types of vaccine, one of them can only use for people who are above 18, and the other one is above 16. So far, it has been quite smooth. We have a total of 29 what we call community vaccination centers. Some are doing the Sinovac vaccine. The other one is community neti vaccine, or we call BioNTech vaccine. So we also have for Sinovac, because the storage and also delivery is less challenging. So therefore, it can be done in the private GP's clinic. We have over 1,400 GPs with about 2,000 sites that are also providing Sinovac, and also 18 general outpatient clinics in the public system. For BioNTech, of course, in the there are a total of, I think, 7 plus 12, a total of 19 community vaccination centers that is providing BioNTech. So far, I think the latest figures, we have about 250,000 people in Hong Kong already been vaccinated, and of course we hope the numbers will go on. But that is only the first dose. We need 2 doses. So I think so far we have been trying to promote the confidence of people in vaccination, because it is voluntary, and we have a choice, for people as to which vaccine they're going to get in different centers. But I think it is important for us to have public and also transparent information about each vaccine, so that people understand what technical platform they are in, and what are some of the possible complications or side effects, and what are some of the contraindications that, in what condition that people shouldn't be taking the vaccine. So all these are transparent, and we have a dedicated website. And of course, the most important is because the vaccine development is still pretty new. Because it has started, it's R&D, for about a year. And so therefore, the time frame of development and research is really, really short. if you compare with other developed vaccines. So therefore, we have developed a mechanism under the Department of Health to really do surveillance of all the vaccine-related adverse events, so that we are aware of the situation, and that we have a notification system by the healthcare professionals. So all those are in place, but it is still important to get people's confidence, because with some of the cases that they have got vaccinated, but because they also might have other conditions, and it happened that they died, or in cases where they have gone into the intensive care unit, people started to worry. But because we have a clinical events committee of experts to look at, the most important thing is to look at whether there is any causality. So the causality assessment is most important. And so far, our experts have told us publicly that all these adverse events, so-called, do not have any relationship or causality with the vaccination.
I think you talk about the causality. I guess one of the questions I want to ask you, what are your major concerns? Like you said, everything has been rolled out, everything has happened so fast, and the development has been really, in record time, less than 11 months. And when we were talking to Professor Cowling, I remember our first program, we thought it was going to be 2 or 3 years to get a vaccine out, and in the world, in Hong Kong, really less than a year. So what are your major concern as, our Secretary of Food and Health here in Hong Kong with a vaccine rollout?
I think the most important thing is really for more people to get vaccinated in the shortest time, because with the prevention and control of the epidemic, I mean, we have been, doing it for a year now. We have different waves, and we have been successfully curbing, some of the waves. We are in the tail end of the fourth wave now, but then I think vaccination is our hope, because with more people getting vaccinated, the shorter time we can achieve a larger proportion of people getting vaccinated. That means, one, that they are protected individually. Two, I think, their friends, their family are also protected. And if we have got enough people, we can achieve a herd immunity, so that the entire society is vaccinated. And with that not only can we control the epidemic with less confirmed cases, and that people's health and life are protected, but also I think we are about to hopefully resume, many of our daily lives, and also our economy, as well as, our travel, because many people are really hoping to travel, not only for pleasure, but also, I think, for business. In order for us to revive our economy, I think, some travel, be it across the border to the mainland or international travel, is important. So I think the more people are getting vaccinated in a shorter time, the faster we'll be able to get our herd immunity, the better we are in a position to discuss with other places for these vaccination passports, or some negotiation.
I think you're so right about the travel. I think people, Hong Kong, I think people forget that Hong Kong is a small place. We're a global city, and we're proud of that. But for 7.5 million people, it's really unheard of that in this last year or so, we cannot even go across the border without quarantine, and also, or even Macau.
Yeah.
And we realize how small Hong Kong is, and the importance of trade to Hong Kong. But one of the things I want to also kind of stress is how well Hong Kong has managed the COVID-19 pandemic. Over 11,300, over 11,000 cases, 203 deaths in a city of 7.5 million. And I'm contrasting this with Israel, which is slightly more. They're almost 9 million people, and 824,000 cases, over 6,000 deaths. So Hong Kong has really managed in terms of, managing the crisis, the pandemic really well. But right now, I guess with a vaccine, it is really about getting us traveling, but it's kind of back to normal a little bit. Whatever normal is, we're going to have a new normal for sure. So I think that is something that Hong Kong is working on. And one of the things that Hong Kong, what I find very interesting is having just registered myself, how easy everything has been. The government in terms of also getting the tests,
Yes.
right now, Asia Society Hong Kong, in order to be open to the public, we qualify under a scheme. So every 2 weeks, all of our staff are getting tested, and my negative result came back last Friday. So for us right now, the government has been very efficient, and I knew it would be very efficient in rolling out the vaccine because, again, very easy. It took me less than 5 minutes to register, and they already have my second dose scheduled. And I'm looking forward to all the friends who have taken it. The process has been very, very seamless. I guess the question is about trust. I think that's the Hong Kong issue. I mean, it's not just Hong Kong. Almost every nation, there is a lot of hesitancy on the part of the public because, like you said, some of the technology, especially the mRNA one, the Pfizer BioNTech one, it is a new technology. So how do you address that? Even informally, I've asked friends and informal survey, 40% of people said they are not going to take it, and 60% will eventually take it. So how do you address that trust factor?
I think trust is indeed, I agree, is a very important issue, and somehow I think in the past years and before the epidemic, because we have this social unrest, and so the trust on the government to a certain extent has been quite fragile. But we are trying to gain the trust. But on this health issue, on this public health issue, I think, first of all, people should trust science. Second, I think they should trust the experts. For the vaccine that we have authorized for emergency use in Hong Kong, we have an independent expert panel to look at all the data supplied by the vaccine manufacturer. That is the clinical trials data, phase 1, phase 2, and phase 3. And not only that, we're also requesting them to supply data to us even after we have authorized them. That is, after they have gone post-market data, our experts will look at it. So all the vaccine that we have now authorized for emergency use are safe, efficacious, and also of the required quality as recommended to the government by this panel of experts. So I think, and also, with these vaccines, the benefits actually outweigh the risks that we are exposed, in this epidemic. Not only in Hong Kong, but as you have already said, we're an international city. So we are also subject to the pandemic, globally as well. Although we are already having a very stringent border control measures because we want to make sure, all these new variants, cannot, go into the community. Even if they happen to come into Hong Kong, because we are an international city, but we have different safeguards. For example, the testing at the airport, the quarantine for 21 days, in the designated hotel and designated transport, and all these closed loop quarantining that we are trying to safeguard. So it is important that I think within the community that we get these vaccines so that our life, our social distancing measures that I think, some people are suffering, can get back to normal.
I think on that note of, you're right about, it's better to have the vaccine than not. The Israel numbers, I guess, in over 50% of the population, about 50% of the population have been inoculated with a second dose. And the preliminary results from that is 98.9% effective in preventing death after second dose has been administered. So I found that number very, very encouraging. So that is something that I think you're right about the science, getting the information out, it was going to be a priority. But you touch upon the 21-day quarantining, and that when I was telling friends I was going to be talking to you, that has been the number one question. So one of the question has been, with a vaccine, and many of people are going to take it. So I think the comment has been there's been a lot of stick, and is there enough carrot? For example, if you get vaccinated when you travel, instead of 21 days, maybe 14 days or quarantine at home. Is that something? And yesterday, I think the chief executive also mentioned that in his address to LHCO about possibility of some of the changes. I know you probably can't tell us to, but I would just like to ask you about the 21-day quarantining. Will there be incentive for people, as an incentive when people are vaccinated that they won't have to go through 21 days of quarantining?
Right. First of all, the 21-day quarantine was kind of like a new measure that we have instituted for about 2 months, and that was really because of the new variant that we have discovered. Not we have discovered, but there are these new variants from the UK, from Brazil and South Africa, and so on. And so we really cannot afford to have these new variants. First of all, coming into the community and spreading. Secondly, I think we have also tracked all our data. For people who came in, actually, in our day 19 test, there are about 10% of people who get confirmed, positive, even with the day 19. So we at this stage, we're bound to have to keep the 21-day quarantine. But you are right about vaccination. What happened after vaccination? Can it be relaxed, or can it be some incentive? Have some incentive for people? I'm sure with more people getting vaccination, this must be the direction. I mean, we must be able, hopefully, with our experts with more data, to relax, for example, the quarantine, the testing frequency, for example, and even, people are starting to talk about vaccination passports, that is, traveling, or further bubbles. So I think this must be the direction. Right now, I think, first of all, we are looking towards the World Health Organization in terms of any new information. Secondly, I think it's also important globally because there are so many people vaccinating, and there are all these information or data, that the protection and also the infectivity and all these outcome measures of after vaccination, of post-vaccination, that I'm sure many countries are measuring. Antibody, for example. So I think all these would give us more confidence in trying to work out a package or algorithm as to how and when we would be able to do all those different relaxation incentives and so on. So we are actually looking into it, and we are also consulting our experts.
Great. It's good to know because I do plan on traveling, having not seen family member for over a year. So I think that is really good to know. Going back to, we have this question from one of our members. And this is talking about Israel because right now there's a lot of data coming in from Israel because they've agreed to, their rollout really went really fast, and the data is very useful. And as I said before, over 50% of the population has been inoculated. And then the question is, how come they're still getting 3,000, almost 4,000 cases daily? And that points to the fact that, what's a lesson for Hong Kong? But also yesterday, we had heard somebody who had the vaccine, maybe the first dose, I think the first dose of vaccine was still getting COVID-19. And so it's not just you've finished vaccination, done. You can take off your mask. Everything is back to normal. So, there are still cases of, as we can see in the example of Israel, 3,600 cases daily, even after inoculation.
Right. I think first of all these vaccines are new. We know that they have some protection, obviously, but at the same time, how long, will it take after vaccination? I think even if we ask experts, normally, for example, if there are 2 doses, one would have to take 2 doses, and perhaps, 2 to 4 weeks after the second dose, that, the vaccine will start to work. So this is one factor. So the timing is one factor. Secondly, I think the mask wearing, right now, for example, the testing, the contact tracing, and the social distancing measures are proven to be effective. So therefore, I think we cannot off guard, in using all these current measures right now. Looking into the future, and when we have more data after vaccination, when we are more clear as to its protection, as to the timing, and also as to the antibody level that it can generate, as to whether one can protect oneself, and whether one can actually not spread the disease to others, or the virus to others. So I think all these are some question marks that even our experts are now, working on, or waiting, some more data to give a better conclusion. So I think right now, I would recommend people do not off guard your social distancing measures. I think this is most important. But at the same time, I think we should go and get vaccinated, at least to get yourself protected. I think this is one thing that all our experts said, that if you get vaccination, then you protect yourselves. Even if you get COVID, then the symptoms would be less or less severe in terms of the situation. I think that's the least. But of course, there could be more protection that I think each vaccine have already given out these information. So I think right now this is the situation.
Besides the vaccine rollout, which you have been working so hard on, I also want to remind people that we in Hong Kong, we also are witnessing kind of a spike. I'm not. Somebody was asking me if we're still in our 4th wave or this is the beginning of a 5th wave, and because of what happened with the K11 cluster, as well as the gym cluster, in Central and Western. And so how do we prevent that from, I know the government has been, the action has been very effective in some ways. And so I guess one of the concern is still be concerned about outbreak. It's not like the vaccine is going to be answering all of our problem. And I want to also remind people that in Hong Kong now, for the last couple of months, the bars and pubs have been closed. So even despite a lot of the measures, the social distancing measures, we are still seeing these community clusters. And so how do you manage this, the community cluster from going out of proportion, growing so fast, and also managing the vaccine rollout?
Right. I think, we have to have this multi-pronged approach. First of all, in curbing the epidemic, all along we have been having, 3 major strategies. First is the border control measures, so preventing the virus from coming in internationally. Second is to prevent the spread within, the community. So that is through 4 areas of 4 strategy: testing, contact tracing, quarantining, and also isolation. So people who are confirmed cases, they should be isolated in hospital. People who are close contact, they should be sent to quarantine centers. But we try to do, different types of testing: compulsory testing, target group testing, and also voluntary testing. So every day, our testing capacity is over 10,000. So we have been more and more people, testing in buildings, in workplaces, so that because of these community transmission chains and also asymptomatic cases, that we have to find them. And of course, after we find them, we have to contact trace, their close contacts and also contacts, and sort of to keep them in quarantine centers so that they cannot further spread. And the third strategy is really social distancing. Now, there is obviously a limitation to the testing, to contact tracing. But if all of us, everybody in the community is, not going out so often, being more restrained with the mask off activities. Of course, we have all entered into a new normal. Then I think it can also help. Now, with the recent 2 clusters or outbreaks, first of all, it's like a super spreading event. So we were actually quite worried because we are already we are already reaching the tail end of the 4th wave. So our Center for Health Protection said even with these 2 outbreaks, we are still in the 4th wave because they have done genetic sequencing, and all the genetic sequencing studies show that we are still is the same virus in the 4th wave. So I think everybody would have to do their part in terms of be very careful about mask off activities, and also try to be very cooperative with us in terms of our measures, because, for example, on the one hand, the situation is vulnerable in terms of the epidemic, but at the same time, the government as a whole cannot not sort of relax gradually some of these measures, because people are expecting, and the economy and is not good, and there are also people unemployed and so on. So somehow we have to start relaxing gradually. But as you can see, once we have relaxed, there are these clusters, coming back again. So we do appeal to everybody's cooperation to, for example, while you go out to eat, after eating, put on your mask as soon as possible after you've eat. Of course, people would like to socialize a little bit more, but, try your best, to help. And we are also appealing to the public to not together, because gathering would pose risks. So even with the gradual opening or relaxation of these measures, we have, tried to put in regulations, new regulations. For example, the Leave Home Safe app that help with the contact tracing, the testing of staff in these scheduled premises in restaurants, and most recently we have also put in another 2 new regulation for the gym cluster. Of course, we ask them that they must wear a mask at the gym. Secondly, we have also put in another new regulation that is to ensure the air exchange, has reached a certain level, so that indoor activities, if people are off mask, then at least the air would not be just trapped there, and then because the transmission, although it's droplet transmission, but some experts also said there are some short range air transmission as well. So we want to be absolutely sure. And of course, there are other infection control measures that we have also instituted in the scheduled premises. So everybody may have to do a little bit more in order to help this situation.
Well, we've come so far in this year, and I know my habits have changed, as a lot of us have. And it's all, because again, the number shows, the truth is in the numbers, right? Hong Kong's numbers are quite low compared to the rest of the world. And we, right now, the restaurants are closed at 10. Yes, I was telling friends in the States, we do have dining. We can't go out and eat, but it's a table of 4, no more than 4 people, which we have abide. And also, I think these rules, I think we've learned to live with it here in Hong Kong. And in the beginning, it's not easy, but I think, again, the government has made it very easy for us to get the testing. So it's almost like on your way to work, you schedule the appointment, you get the testing done. So that, Hong Kong, I think when this is over, and even not when this is over, I've heard that Hong Kong is a great place for the case study of how we have implemented certain things, right? And I know we also have been getting criticism,
Yeah.
your office as well, Hong Kong, for some of the recent issues regarding quarantining and family separations, and that we will talk about in the future as well. You know, I think one of the things I have to say is Hong Kong, whether it's government or business or ourselves, we really learn quite fast and we change on a dime. And right now, I think everyone outside, when you go outside, everybody's wearing a mask.
Yes.
And it's the other day I you know, forgot my mask and the elevator door open, and I just ran back to the apartment to get the mask on because you feel naked without it. So that's not the case in other parts of the world. And then the numbers again shows itself. So I think that is something that we in Hong Kong deserve recognition. But there are lessons learned from many of the things that we're going through right now. But another question I also got a lot from friends and people that I know, and also maybe because Asia Society Hong Kong, our members, there are a lot of also expats living, you know, who are our members. And some of them are interested in the mix and match approach. And I remember asking Professor Cowling this question, and he said some of the countries are studying some of the effect of mix and match the vaccines. Because you right now generally have two technology, again, quite new. And so have you seen anything about the mix and match approach to the vaccine? Is that something the government is looking into? Or is it something that, you know, it should be avoided, you know, in terms of mixing the two type of, especially here in Hong Kong, the two vaccines that we're using is two different type of technologies, correct?
Yes. You are right about the two different type of technologies in terms of the two vaccines that are made available to people in Hong Kong right now. So our recommendation at this point in time is that we do not recommend any mixing. So if you have vaccinated the first dose of Sinovac, then the second dose should be Sinovac, and vice versa with BioNTech. Of course, you know, moving into the future, as you said, Ben Cowling said, there are studies that is going on to see if whether a mix and match approach would yield better results, or whether it is the approach in the future. So I think we have to await for, you know, some of these science and results to come out before we can make any judgment. But right now, our experts do not recommend any mix and match.
Okay. And right now, I want to kind of touch upon the when do you think Hong Kong will achieve herd immunity with this ambitious plan? And I know you know it's hard to guess in terms, but right now, in your expert opinion, with this ambitious rollout of getting 80% of the population eligible for shots to get it done, I mean that's really unheard of. This week, when we lowered the age to be over 30.
Yes.
I know that's envy of a lot of people outside of Hong Kong. So when do you think we can achieve herd immunity? When would you like to see it? I mean, I guess is another way of asking the question.
Yes, for the vaccination provision, I think, in fact, we are quite lucky, you know, in Hong Kong. First of all, we do not have any problem with the vaccine supply. We're able to get the vaccine, to procure the vaccine. Secondly, I think people would have a choice, you know, that they can choose which type of vaccine they're going to take. And third, I think in terms of timing, we think towards the end, within 2021, that we should be able to make available, you know, vaccines for everybody in Hong Kong. You know, now is about, you know, 5.5 million, about 80% of the eligible groups. But towards within 2021, we'll be able to make it available to everybody. Now, of course, the government would have to continue to work hard in terms of, first of all, promote the vaccine confidence among people, or reduce the vaccine hesitancy. That comes with a number of factors, of course, you know, information, transparency, and also incentives that we have talked about. So I think all these would have to come into play in order to promote, you know, the vaccine confidence, so that we can achieve, you know, a bigger proportion of people getting vaccinated and better protection and better, control, of the epidemic in Hong Kong. Of course, we would like to do it as soon as possible, but of course, because it is voluntary, we still have to look at the response of people. And we are monitoring actually very closely. For example, if people are worried about the adverse events, we quickly would have to provide more data so that people understand. And also the causality assessment, we try to be as transparent as possible. We are also working with different experts at different stages of our vaccination rollout so that we always act on science and also transparency.
One of the questions I was not here in 2003 doing SARS, and SARS hit Hong Kong as well as Asia really hard. And so I guess the question I have for you is about what are the lessons that we learned in Hong Kong, particularly from SARS, and that has helped us to tackle this, global pandemic. And I remember when I talked to Professor Cowling in February of last year, thinking that, like SARS, hopefully by a few months, COVID would be over. And a year later, we're still living with it. And so how do you think Hong Kong has learned from it? And, in some ways, has it, helped you? And, also your own personal experience from 2003, and how has that helped you in terms of this current pandemic that we're facing?
Right. I think at 2003, I was working at the University of Hong Kong as an academic. And of course, that at that time, we do a lot of research, on, SARS and all that. In terms of the healthcare system, I think the Hong Kong healthcare system or under the Department of Health, for example, the Center for Health Protection was created, after SARS. Essentially, it's like the CDC. So we have a lot of different capacities, different expertise, hardware, software ready in terms of infectious disease. For example, an infectious disease block, in our public hospital system, and different isolation beds within the different hospitals, and so on and so forth, and also the quarantine camps and so on. But I think it is not enough for us, actually, our experience that we have gathered from SARS, which is very, very useful. We have all these response plan. But really, having gone through, the past year, those experience actually not enough, for us to deal with this epidemic. We have been really learning on the dot because it's a new virus. The capacity or the scale of the not only the facilities, but also manpower and also expertise that is required to deal with this pandemic. At SARS, that was a shorter time, but now is a very, very long time, not only for Hong Kong, but also for the entire global community. So I think many of the things that we have instituted or the prevention and control measures, we have never done it. We have only done it for the first time. For the first time, we have used a public housing estate as our quarantine facility. We have built these community treatment facilities at the AWE Hall, near the airport. We have been setting up these testing centers, at the airport. So every returnees have to gone through testing. We have set up all these different community testing centers, mobile testing stations, and so on and so forth, again, for the first time. So not only for the government, for people who are working to fight against the epidemic, but I think the people in Hong Kong are also experiencing, this epidemic, and many of these experiences, control measures for the first time as well.
One area where I kind of want to end too on this is, unlike SARS, because it was short duration, and my understanding is people in Hong Kong came together, they fought it, and although there were a lot more deaths, But the community really came together and fought that, fought out that.
Yes.
Right now, because we're all living through it, and I'm sure you yourself, the mental health aspect of it, it's something that I think we're all going through it globally. Because just when we've been through fourth wave, and hopefully the tail end of the fourth wave. I have friends in the States and other places that they never came out of the first or second wave.
Yeah.
So that's another difference that I feel, that it's this, we're all pretty tired of this thing, but it's still not over yet. I mean, although vaccine, the flip side, the positive side of it has been developed so quickly. So I guess the question I have for you is, when do you see the end? Whatever the end is, the end could be when we can travel again, when we don't have to wear the mask, and because it's also another thing that I'm realizing is not every country has a vaccine, and people have attacked China for vaccine diplomacy, which I find in some ways unfair. My understanding is China is not going to vaccinate. I guess by the end of next year, they had Dr. Gao has said middle of next year, 2022, they hope to have 80% of their people vaccinated, and so they're actually donating a lot of vaccines to Africa and or developing countries, and so even if we get 80% vaccinated. There is still going to be issue when we travel to China. Not a lot of people in China are going to be vaccinated. So I guess the question for you is, like, when do you see this being over? Or will it be over? There's also been study in saying that, hey, COVID-19 is going to be with us for kind of like the flu. So I guess the question here, when do you think it's going to be over?
Well, I don't think this is an easy question, to answer. First of all, I think obviously we hope, with our efforts, with our, effective measures, the fourth wave is going to end very soon. Weather is also, something that would affect. In the winter, it's always worse because the virus is more active, in the winter. But, coming back to the issue as to when, I think how many people getting vaccinated is actually quite crucial. If we can have more people get vaccinated, the better it is protected. And the faster we are going to go into a situation whereby the epidemic situation is more stable. So I think, we are start seeing, some of the decrease in the number of cases in some countries where they have a big number of people vaccinated. Of course, each of the vaccine with more data, we are still awaiting, many of the results and also data for us to have a better handle, of this. But the direction is, it must be, if more people getting vaccinated in a quicker way, then the better we are in terms of our epidemic situation. So this must be the direction. How fast, how soon, I think we have to wait and see. And the faster we get more people vaccinated, obviously this is better. I can certainly understand, people are getting tired of it, and so because we are getting tired of it, and we need to get out of this, and I think vaccination is really, our hope. As I've said earlier, not only should we get vaccinated, but we really should be getting into this new normal, because this new normal of perhaps, always keeping some social distancing, always having wearing mask, and maybe always having not big groups gathering, and all these, may have to go on for a little while before we can, get back to the sort of normal. Whether globally, there is, we will be all changing into this new normal. We are yet to see, because globally there are places. All the places are starting to get vaccinated. And as I've said, there are still places in the world that have not had vaccine, but we are very lucky in Hong Kong. So I think we should capitalize on this opportunity.
I guess I have two questions that we're going to end because it's great to have you here, and I know I'm going to be thankful for your taking time from your busy schedule. But I guess the question I have now is really about Asia. What is your assessment, or from your perspective, how Asia, in terms of is handling the vaccine rollout? And I guess specifically, maybe even example. I know Singapore and Hong Kong are ahead of the curve.
Yeah.
And and China, as I said, they're going to, they have big plans, but they're being kind of realistic because their numbers are so low, almost non-existent in terms of COVID numbers. So how about the other parts of Asia that you think are in terms of what they're planning for the vaccine rollout?
Well, as far as I understand, for example, some of the nearby countries, Singapore, Japan, and also Korea, they have already started vaccinated. And there are, of course, other countries in Asia that I'm sure are preparing, to do that, because we know that with more vaccine coming out, which we see actually different platforms and also different brands are coming out. So I think the availability of vaccine under COVAX, under the World Health Organization, is trying to have this platform to distribute vaccine to different countries. We have also joined, but we are lucky because we are having a two-prong approach. One is we have joined COVAX, but at the same time we are also negotiating with the different vaccine manufacturers, and we are lucky now that we have authorized two types of vaccine. Of course, I think we do hope that more countries, be it in Asia or globally, will be getting vaccines so that, the entire world can get out of this pandemic, as soon as possible. Hong Kong cannot be alone because we are a global city. We will ultimately be affected if the rest of the world is not improving in its pandemic situation. So we do hope, the entire world can be going towards the direction of, getting vaccinated, and that we all would fight the virus together.
Right. I think Hong Kong and Singapore had a travel bubble plan for that we were going to launch. Many of us were very excited. I think it was talked about in December, and it was delayed because of I think some of the cluster outbreaks, and then my understanding, India is also developing their own vaccine, which is also a good, interesting development, which we're going to keep an eye on. So I think, yeah, you're right. If we're the only one who get it and no one else is getting it, you really still can't travel, right? So I think it is really incumbent on all of us to make sure that we're all in this together. It's not just us, but other parts of the world also needs to be vaccinated. I guess I want to end on the local issues or local timeline, because we currently are. The social distancing restrictions will end. The government announced the other day that current measure they will relook at it on it will end on March 31st.
Yes.
So what are some of the things that you're looking at that will help us lift and maybe make a social distancing measure kind of make things more open after March 31st? What are some of the markers? Is it numbers? Is it vaccine rollout? From your perspective, what are you looking at?
I think, first of all, of course, is the overall epidemic situation in Hong Kong. If we are really seeing the tail end of the fourth wave, that that the situation is more stable, obviously we can, think about whether we can have more relaxation, again, in a gradual manner, again, with some requirements. Secondly is vaccination, because we have already had the vaccine. So it is important, for those places that have high exposure to people. For example, people who have customers, the staff, for example, the schools, the teachers, to get vaccinated, because then we can, with all these activities, if we hope all these activities can get back to normal, even in a slightly less stable situation, then with vaccination, that can also help. So again, the vaccination rate or vaccination percentage is also important. I understand there are already different trade sectors trying to encourage their staff to get vaccinated so that we are all prepared in case there is the situation of the epidemic in Hong Kong is stable, then we can, relax more places, then they are all, ready, not only with testing, but also vaccination.
Well, thank you, Dr. Chen, for your generous time this morning. I'm really grateful for you spending the time with us and answering the questions that we've posed to you. And I look forward to welcoming you back, maybe when it's under less strains right now. But thank you for all you do. And thank you on behalf of Hong Kong and behalf of Asia Society Hong Kong for your dedication and hard work. It's been a tough year, but I think right now we can see, I truly can see the light at the end of the tunnel, because with the vaccine, rollout, and so far so good. Everybody has been, the numbers look good. I understand eightfold in terms of the people who have registered because of the recent announcement of lowering the age to 30. So I'm really hopeful that those people who are interested in getting the vaccine will do that. So again, thank you so much for your dedication and hard work.
Thank you, Alice, and thank you, Asia Society, for providing this opportunity. And thank you, Ronnie.